So, Jill, what brings you here today?
I've been having a lot of, thoughts about cleanliness, about pretty much not getting infected with any kind of disease. I find that I need to wash my hands, almost every hour. I spend probably 15 minutes washing my hands when I do, and, I have to wash all the way up to the elbow with a certain amount of soap. Usually it has to be pump soap. It does really interfere with, me going to certain places because I don't know whether they're going to, have the right soap that I need. Sometimes I carry it with me when I go to places that I'm very unsure about. But it's really been interfering.
And when did that start?
It started, I would say, about 10 years ago. It's gotten, a lot worse recently because it's interfering with me getting things done at work.
And during these 10 years, have you been washing your hands?
Even
if it might not have been as frequently, you've been washing.
Yeah, I've always been very clean and concerned with my hygiene. But over the years it's gotten more and more difficult for me to really go to a lot of places due to it.
Right. Well, one of the things we know is that the more you wash and the more you give into a compulsion, the worse it gets. It's a snowballing effect. So one of the things we'll need to work on is getting you to stop washing. Obviously, that's why you're here. So
right.
Tell me, what are you concerned? I know you said you're concerned about getting ill. What kind of illness do you think you would get if you never washed your hands or just washed, let's say, once a day or twice a day?
Well, cancer is obviously very prevalent, and, people come down with all different types of cancer, and I guess that would kind of be the thing I'm most scared of, is that if I'm not clean and don't watch, what comes into my body and, what I touch, and I feel like, I can kind of get any type of cancer.
So you believe that you can prevent cancer by washing your hands up to the elbow with a particular type of soap?
Well, that, and also, I don't usually touch people. I don't really like to touch, doorknobs and things that are known to be really infested with germs. I don't touch railings and things like that.
Are you using tissues or baggies or anything at this point?
Well, during the winter it kind of makes it easier for me because I just wear gloves a lot.
Right. Do you throw the gloves out?
Often, but it depends. If I'm out for the entire day, I'll keep them because I'm dirty the entire day.
Right.
But as soon as I get home at night, then I'll throw them out and I'll use another pair the next day. But
Are you
it's not that
washing the
expensive
gloves?
because they're the little knit ones. So
I see. So are you throwing it out every day, or are you washing them, dry cleaning them?
I wash them for, I would say, about a week, and then I throw them out.
Then you throw them out. Okay. So is cancer your main concern?
I guess kind of all illnesses. Cancer being the most important because I've had loved ones that have had it, and it's just been really rough for me. But I guess kind of whenever I feel that I have a sniffle or anything's wrong, I immediately think that I have to kind of wash more, and maybe I should skip work today and just make sure I'm healthy.
Okay. And how long are your showers at this point?
My showers are about, I would say, 45 minutes to an hour, depending on, how clean I feel that day. I usually shower, when I get home because obviously I want to get the day off of me. Sometimes I shower in the morning too, depending on how I feel from the night before.
And do you have a ritualistic shower, starting with your head, not touching your feet, or making sure every part is scrubbed?
I think the reason it takes so long is because I focus on my arms for so long, and my hands. Okay. So, I don't really care too much about the other parts. My feet, yes, are kind of a danger zone. So,
right.
I could do the other parts in any other order, shaving and that kind of thing. But I'll continually, if I feel that I've gotten dirty from washing some part of my body, I will go back to my hands and my arms and continually wash them until I feel like they're okay to go on to clean the rest of my body.
And is there a preparation of the shower, cleaning the shower, whether it's with Lysol or Clorox? Or are you okay with the shower? Are you able to put the shampoo on the floor, or do you have to kind of hold it in your hand, or how do you deal with the shampoo and soaps?
Well, I can never use bar soap.
Right.
I need to always have,
Pump.
the pump soap. Within the shower, it's okay as long as I kind of clean it, every couple of days. It doesn't need to be cleaned immediately.
But nobody else is using the shower,
No,
I
it's just
assume.
my bathroom.
Okay.
I feel kind of bad for my brother because, he used to use the bathroom too, but now he has to share it with my parents. But yeah, I mean, it just has to be the pump. And if it has kind of the, sometimes it like crusts at the top,
Right.
that has to be like well cleaned off before I could use it. And if it gets to the point where it gets, too crusty, then I have to throw it out and buy a new bottle.
I see. And
Even
how
if it's
frequently are you buying shampoos or soaps?
Maybe like 3 times a week.
Mm-hmm. Okay. What about in terms of going to the bathroom? Are you using a lot of toilet paper?
The bathroom I don't think bothers me as much because it's me and I can't really contaminate myself. It's more like other people contaminating me.
Oh, okay. Okay.
So that doesn't really bother me much. Of course, public bathrooms are much more difficult. So I try to avoid them at all costs, and I always go at home or, I don't really like to go far away from home so that I can come home to go to the bathroom if I need to.
Sure. Okay. And what about if someone in the family touches you? Are you able to sit in various places in your home? Are you able to sit in the dining room? Are you able to have them give you food, or do you have to prepare your own food?
Well, with regard to, furniture and things like that, I mean, for the past 10 years, my family has known that, like, this is my chair, and
Right.
nobody sits in that chair. It's kind of just not even really mentioned anymore because nobody really goes near it. Preparing food, I mean, my mom does prepare food, but she knows that in order for me to eat it, she's going to need to wash her hands a certain amount of times in a certain way.
And you watch her to make sure she does it that way?
I mean, I guess I can't always watch her, but
Right.
I kind of trust that she wouldn't go behind my back and do something,
Okay.
to hurt me, so.
Right, okay. Well, in order to help you, and I assume you're motivated to change this behavior, do you really believe you're going to die of cancer if you don't wash your hands?
Kind of, but I kind of know it's a little bit silly.
So you have an element of doubt.
Yeah.
Okay, so would you like me to teach you how to stop washing
Yeah.
and not get cancer at the same time?
I would like to have relationships and work again. That would be nice.
Okay. The particular treatment is called exposure and response prevention. It's the only treatment that's been found to be effective for OCD. And we do have medications, but I think at this point I would rather just try to do it with cognitive behavioral therapy. If within 10 sessions or so, or 2 weeks duration, you're not improving, then we could talk about medications, okay?
Mm-hmm.
So we're going to do exposure and response prevention.
Okay.
Okay.